Thanks. Future nurses bracing themselves now for the front lines of the pandemic following a Friday announcement from state leaders. Governor Asa Hutchinson announcing the state board will expedite licensure for nursing students to relieve stress in area hospitals. 5 News reporter Allie Lynch talked with nursing students who say they're ready to serve.
Really intimidating, especially the thought of getting pulled into COVID, just because we haven't had experience with it. The school wouldn't let us be around any COVID cases just for our protection as students. So potentially getting thrown right into it is a little intimidating, but that's our job. That's what we decided to do when we decided to go down this career path.
Meet Jordan Shields. She'll be graduating from the University of Arkansas Fort Smith nursing program in a few short weeks. After graduation, Shields will hit the ground running on the front lines, working as an intensive care unit nurse at Baptist Health, knowing she'll also take care of COVID patients at times too.
They tend to send the people over to COVID ICU who have the least amount of potential to give it to other people. So if you're single, living by yourself, it's just you're more likely to get pulled to COVID. And that's definitely scary as a new grad.
Governor Hutchinson said in a press conference he will fast track 1,104 nursing students so they can alleviate the stress in Arkansas hospitals. The state board will expedite their licensure as well as waive their application fees. Although Shields says she's still waiting to hear exactly how soon after graduation she needs to take the NCLEX exam.
It really just is what they're going to need from us. If they don't need us right now and we can wait a little bit and study more, then that'd be preferred. But if they need us, then we're willing to go ahead and take our test.
Washington Regional Medical Center released a statement to 5 News saying in part, Washington Regional is encouraged by steps Governor Hutchinson has taken to accelerate the entrance of nursing school graduates into the workforce. We anticipate hiring 50 to 60 new nurse graduates in December. One of those graduates being Hannah Mossman, who will work in the ER. Finishing up her last semester of nursing school and gaining as much experience as she can before she receives her degree. Mossman currently works 2 nights a week as an emergency room nurse aide.
I have noticed an increase in just people coming in with COVID symptoms and COVID exposure and wanting to get tested.
In Fayetteville, covering news where you live, Allie Lynch, 5 News.
UAMS says healthcare workers who have been exposed to COVID-19 and test negative after 5 to 7 days can go back to work. Healthcare workers who test positive for COVID-19 but are asymptomatic can go back to work, but they can only treat COVID-19 patients.